He's a pathologist, and I wonder if he has a fax machine. Dr. Page, good morning. Do you have one?
Good morning, Nadia. Yes, in pathology we do use the fax machine, as we do across all of healthcare. Really, still, it is a bit of a running joke, I think, even within our profession. Our long-running love affair with the fax that seems to have no end.
Why are they still used? What do you use them for?
Look, there's one of the issues that we have in healthcare is secure interconnectedness or interoperability. In other words, the ability to send a message containing private patient information, confidential information between health providers who might be working in different systems. One might be in public, one might be in private, one might be in a small clinic, one might be in a large public hospital, to send that information securely. And to be able to share that information with great confidence that there's no risk of it being made public. It is one of the central tenets in medicine is keeping patient data confidential is absolutely crucial. And so I think there is this notion that the fax is a little bit more secure. Now, whether that's true or not, I'm not sure. But certainly email of patient-named information between different organisations is not something that people like to do. Increasingly, we do have secure messaging systems. As most of your listeners would be aware, most general practices, the vast majority of general practices now are computerised, and there are secure messaging protocols to enable referrals to be sent to specialists electronically. And pathology results and imaging results to be downloaded back into that practice software securely. So I don't think we're not sending hundreds or thousands of faxes per day per practice, but for certain types of information transfer, they are still used. The use is diminishing.
Yeah, it's interesting, though, because you talk about, the thought that they are safe and secure. And I look at a report that was co-authored by a woman called Samantha Prime. It was the Deeble Institute for Health Policy and Australia's referral system. And they were basically saying, look, they don't think they are safe and secure anymore. Yeah. And I just wonder why the evolution is so slow.
Look, I think it's to do with cost, Nadia. Health IT infrastructure is incredibly expensive. The electronic medical record project that our state government is currently embarking upon to get all of our public hospitals into the 21st century with a proper digital medical or an electronic medical record that connects all the health information within the public system so that it's all accessible across the system is a great thing, but it's very, very expensive. You've got to bring a whole lot of clinicians and other hospital workers along for the journey without disenfranchising them while changing the way they work. And so that's it is a big project, and it's very expensive, and that's one of the major reasons that we've been so slow in the health sector to move along with the times.
So then, do you think it's unfair to be blaming hospitals and specialists for that slow adaptation of new technology?
Oh, look, I think it is. It's very expensive, and for private specialists, private GPs to be asked to do more electronically without the resource available, particularly in an environment of stagnant Medicare rebates for private healthcare, it is a bit much, and so you do need to make sure you're incentivising practices and hospitals to be able to move with the times.
Dr. Page, the federal government is expected to introduce new legislation which will force pathology and radiology companies to upload results in real time to individual My Health Record accounts or risk losing their Medicare payments and face fines. Are you concerned about that?
Look, no, I mean, not in general. I think there's two aspects to that. One is the mandatory upload of records to My Health Record, provided practices are given enough time and enough support to be able to do that. We're fully supportive of the notion of of patient records being available both to their various doctors and other health providers. And to those patients themselves. I think it's a very good thing that patients are more engaged in their healthcare, and a lot of patients do access their own records on My Health Record. There is some concern about the immediate availability of all results to patients as soon as they're reported. So, for instance, if the pathology laboratory where I work finds a cancer in someone's specimen, let's say melanoma or something in a skin specimen, and that becomes immediately available to the patient before the patient's doctor has had a chance to look at that result. That can be a problem. You know, the way that we break news to patients, that we provide them with their options, we provide them with the outlook is really important and is much better done between patient and doctor than it is between patient and Google after the patient finds their own result before their doctor does.